Good afternoon, everyone, and thank you for coming to the RHRF webinar. I'd like to begin today by acknowledging the traditional custodians of country throughout Australia and their connections to land, sea and community. I pay my respects to their elders, past and present and emerging, and extend that respect to all Aboriginal and Torres Strait Islander peoples joining us today. Welcome to Ramsay Research Month's first webinar on considering a PhD or postgraduate research degree. Hear from those who've done it. Please note that today's session will be recorded and we will have 10 minutes at the end for discussion. If you've got any questions throughout the presentations today, please use the Q&A function at the bottom of your screen. So I'd like to kick off today welcoming our fellow panelists. Firstly, welcome Dr Bernadette Eather. Bernie is the Chief Nurse and Clinical Services Director for Ramsay Australia. She's also the COVID Executive Lead for Australia and has managed Ramsay's COVID response since the beginning of the pandemic. Bernie is an alumni of the University of Sydney, University of New England, University of Technology and University of Melbourne. Yeah. I'd like to also welcome Liam King. Liam is the National Research Lead for Cancer Care and Cancer Care Educator with Ramsay Pharmacy and is a PhD candidate at Griffith University. Welcome, Liam. And finally, Karl Espernberger. Karl is a grade 3 physiotherapist at Donvale Rehabilitation Hospital and is currently a PhD candidate at La Trobe University. Welcome all. So I'd like to kickstart with you, Bernie. Tell us a little bit about yourself and your PhD degree and topic, and how long ago did you submit your thesis? What was it like?
Well, you'll all be pleased to know when Nicola said she'd asked me that, I thought it was so long ago, I can't remember. But then I remembered it's hanging up on my wall. So I had a look and it was issued in 2010. So I finished in 2009. So background, I'm a nurse. I'm an intensive care nurse clinically by background, very passionate about patient safety. And I'll probably say the word passion quite a bit today, because I think in terms of moving forward, if it's a topic that you are not passionate about, then don't research it, because it becomes quite soul destroying to be pursuing something with such rigor and so much time and energy if you're not passionate about it. So I started in 2002. My kids were a lot smaller then, and I had just finished my master's in health management, and I was working on the ward. There was a lot of deteriorating patients, and I was very interested into, why patients would deteriorate on the ward. Why couldn't we get a response? And really, had started my research back then. It took me 7 years to do my PhD. I took a year off over the course of that 7 years in 2 6-month chunks, just kids and family and work. And so I worked full time and I studied part time, hence it taking, 6 years all up, but over the course of 7 years. So yes, I did that through University of Technology in Sydney, and I vowed that I would never study again, that I had done and dusted. But 10 years later, or not quite 10 years later, in 2018, I was very interested in law. So I've just completed a Masters of Health and Medical Law at University of Melbourne. So never say never. This is not the end of your research and study, but only ever the beginning. Thanks, Nicole.
Thanks, Bernie. Karl, so I know you're still completing your PhD, but tell us a little bit about the topic and why you chose to do a PhD.
Yeah, I can say I'm past the halfway mark now, which is nice. And like Bernadette, I'm also doing it part-time. So working full-time and PhD part-time. The topic is the area of stroke, and so neurological rehab in the subacute setting, and specifically how we can help people after stroke return to an active life, and what are the limitations, the barriers, the things that are getting in the way of that, because unfortunately at the moment it's not the case. People after stroke are highly inactive, and it's a bit of a cause for concern. It was really interesting. It's always interesting hearing about other people's journeys and how they get into their PhD. Mine started a little bit differently in that I didn't have a topic, and I think we'll talk about this a little bit later, but rather than having the topic and then trying to find answers specifically for that, I sort of went into it with a desire to conduct research and go on some problem-solving missions and to go explore data and to do that type of process. And I was open to a topic. I just had a general field that I was quite interested in, and so the process was probably a little bit different. But yeah, that was kind of how I got into mine on a broad note.
Awesome, thank you. And Liam, tell us a little bit about your PhD topic and what your experience has been so far.
Thanks, Nicola. Alongside Bernie and Karl, mine is a part-time PhD whilst working full-time. As Karl is, I'm still in the process of completing my PhD, so I'm about 2.5 years in, hoping to get it done within the next 2.5 to 3 years, but timelines continuously change throughout your PhD, so we'll aim for that and do the best, but we'll see. And I guess my topic is repurposing alpha adrenoreceptor blockers, so agents that are usually used as antihypertensives or in men with enlarged prostates as an adjunct to different treatments for prostate cancer. So alongside radiotherapy to enhance the radiotherapy effects or chemotherapy in the metastatic setting. And I guess how I got into that is kind of a combination of how Bernie and Karl have done it. So my topic, my PhD supervisor, who is at Griffith, and I did all my undergraduate and postgraduate pharmacy study through Griffith, and did a Master of Medical Research prior to enrolling in my PhD. And it sort of just evolved over all of those degrees, working with my supervisor. His area was prostate cancer and research, but throughout my career as a pharmacist, I've also specialised in the cancer space as well. So it's sort of a topic that has developed and been already worked on many years prior with the research group, but it is also something that I'm quite passionate about and probably my area of expertise within the pharmacy world as well. And I guess I echo that sentiment that Bernie had, that it's got to be a topic that you're passionate in, whether you start and decide that topic at the start, or you sort of pick that up. If you're not passionate, when you go along with it, it makes it very difficult. And I think sometimes, even with a PhD, a passionate topic can become a hard topic, but because you do have that interest in it, you're able to continue through on it.
So tip number one from all of you is passion. Passion is important. And the second tip I've taken away from all of you is that doing it part-time while working full-time is really feasible, but connecting it to your current role or having some connection into your role is probably important. Is that a fair comment?
Yeah, definitely. I think that, look, as I said, the passion for me, because it's a long haul. It's as I said, it took me, albeit over a 7-year period, 6 years of study. It's a long time to keep going. So having that that passion drive you, that you wanted to, the curiosity, why is this happening and what you can do about it, I think is really very important. And look, it definitely is doable. I look back now and I think, what was I thinking? I had 3 kids, they were under the age of 10. I was like, working full time, studying part time. So, man, do it while you're young. not old like me. It gets really exhausting. But I do think that just to keep going. But it is, I think the constancy of it as well is interesting. It took me a long time after I'd submitted. You might be out somewhere, or you're sitting watching TV and think, oh, I've got to go, I've got to do some reading, I've got to do. I'm like, no, I don't. It's submitted. I haven't got it there, sort of thing. So it is something that you carry with you for a very long time. So when you actually hand it in, it's it's certainly a lot. So I'm definitely with Karl and Liam at the moment. When you're along your journey, you're carrying this with you for quite some years, and it's quite hard to let it go in the end. But definitely worth it.
It's interesting. It's interesting to hear other people doing it with full-time work as well. And I guess I just wanted to make it clear that that's not necessarily the norm. You don't have to do it that way at all. And I'm actually in the process, just in the last couple of weeks, of reducing my hours, because that's the right thing to do for us. And like Bernie was saying, I have a little 5-year-old and a 3-year-old, and my wife's also finishing a degree this year, so we're a busy little family. And while full-time work, I was working 4 days a week, and my 5th day was kind of like my study day or my PhD day. That worked for a decent period of time, but it's getting to a point now where we need to make some changes and change some hours and do a bit of a shuffle and make sure it works for us. And we'll probably talk about this a little bit later when we start talking about sort of like tips and the good things and maybe some of the bad that we wish we had done differently. But I think that's an important one, just staying flexible and making it work for you as well, because there's different ways of doing it. It doesn't have to look the way that one person makes it look. So.
Yeah, I think that's an excellent point, Karl, and just the flexibility aspect and just knowing that you can change as you go through it. Given it's such a long journey, I imagine that's a critical part of it, isn't it?
Yeah.
So given that conversation, why do it? You know, what prompted you all to start a PhD and even start thinking about it? Apart from passion and curiosity, we've got those two.
I think I'll answer that one first, Nicola. So touching on Bernie said at the start, there was an interest there of how to improve current. You know, we're healthcare professionals, so we're all always generally, if you become a healthcare professional, you do it for the love of the patient and wanting to improve patient care. And research is a way that I think even a lot of health professionals don't realise that subconsciously they probably do that, you know, day in, day out by looking up guidelines, what's the best treatment, you know, doing those reviews of the evidence that's out there. And I guess the PhD or a research degree is just sort of formalising that process and learning structurally how do you do that and how do we do that effectively, and being able to translate that finding to help others. So, you know, it's a matter of doing that review of the evidence and finding, okay, for a patient in front of me, I can help them by implementing this, but how do we share that out with the broader healthcare community to the work I've done to help more people and help more patients, and learning those skills through our PhD and formalising that to then be able to also assist with career progression and development along the way as well.
Thanks.
Yeah, and I think the same, as I said, for me, it was more, you know, importantly, I think was also access to having academic supervisory support. There was a professor of nursing at the hospital where I worked, and so there was a culture of research that, you know, there were research meetings, there were journal clubs. So I was fortunate to be in an organisation that recognised the importance of research, clinical research, you know, not lab-based research, but clinical field research. So, you know, I was in that environment, which was really helpful. And, you know, I had I suppose, the wicked problem. Why was this happening and what did I do about it? And part of my job was to fix that, was to come up with solutions. And the fact there was a professorial appointment at the hospital, they said, you know what, you should, you know, because after a few months I'm saying, and then this happened. And then, you know, the patient deteriorated, and then that happened, and then we're not, you know, it's a communication issue, it's this or that. And you should really study this. This should really be something at a doctoral level that you could focus on. So it was something I was passionate about. How to say, you're interested in, or something that drives you crazy or whatever it is. For me, that's how it started. But I was very lucky. I was in an environment that was conducive to clinical research. And I look back sometimes and I wonder, would have I implemented all of these things without the kind of the critical analysis, the why behind it that you pick up in your doctorate, that, you know, maybe I wouldn't have done one. But the fact is I was in an enabling environment, and I think that's really important. And I take that very seriously as chief nurse. And I know it's something, you know, Nicola and I talk about frequently, is how do we create a culture that is conducive and permissive for research to occur, that's encouraging. And I think for me, that was something I was very fortunate to be in that organisation at that time.
And Karl, I imagine the kind of the environment at Donvale is slightly different to what Bernie's described, though it's still great, don't get me wrong. But what for you? What prompted you to do one?
Yeah, no, you're absolutely right. It's very different. And I love some of that stuff you guys were talking about then. Maybe we'll have to chat later about harnessing, sort of developing culture for research and stuff. We'd love to get some of that going. But For me, it was totally different. I finished my physio degree, and toward the end of it, kind of knew that I was onto something. I didn't know what I was onto, but I just knew I was enjoying the learning process and discovering and exploring what was going on. And I had a bit of an area of interest, sort of like a population that I was interested in. I knew I was going to pursue that to some degree. And so I went into undergrad interviews saying, this is something that I want to do. Are you going to be able to support me when I end up doing this, most likely? And sure enough, a couple of years later, then I went to my management team and said, you remember how we spoke about this during the interview as well? And so I just decided that I wanted to do it myself, and then figured it out. So I had I did have some people around me who were in the process of completing their PhD, and that was incredibly helpful, some colleagues at Donvale. But apart from that, I just went exploring and figuring it out on my own, and I'll touch on that a little bit later. So it was more, it just came from, just knowing that I didn't think my learning journey was over yet, nor is it ever, of course, mind you, but I just wanted to continue more, and I was excited to get stuck into it in a research-based way, I guess.
Yeah. No, thank you. And I guess, Bernie, since Karl and Liam are still doing their PhD, I'm going to ask this one to you. What benefit has doing the PhD given you, do you think?
I suppose there's two things. It's how does it shape you as a person, or for me as a manager? So there's that component, and then I suppose that career progression. It's funny. As I said, I'm an intensive care nurse, so I'm very used to working in a highly stressed environment and maintaining your calm and doing that. But particularly during COVID, the last few years, and leading our company's COVID response, everyone's you're always so calm. It's always that resilience, and I think it is. You get through that. So I would say personally, it taught me resilience. It taught me focus on the end game, like that process of, it's always that, the saying you can't see the forest for the trees, you can't see that big picture. And I always find the picture, you've got to see the trees, you've got to know what it is and how it all fits together in order to get to the other side. So I think it does change your analysis. I'm a very not critical in a negative sense, but I do have that, or why would we do that way, or so my ability, I think personally, to development-wise, to analyze things, so I'll read things differently. I'll go to a party with my husband and I say, oh my God, did you see that they didn't speak together, or this or that, and this must be going on? He's like, you just live in a different world of, so I feel like I can see all these layers that your ability to analyze things, and I think there's a lot of those skills, your problem solving skills, your analysis, and above all for me as well is your ability to write concisely, to write with meaning, to convey a message, honing I would not be as good a writer, so I'm big noting myself, but you become an incredibly good writer doing that. So all of those skill things and how it impacts you, I think, you carry with you regardless. As I said, for me, it's, 12 years since I submitted. So clearly, on top of that, 17 years since I started, you do carry those things with you. And then I think, look, the reality is career-wise, in health, it does open doors. It identifies, would I be the chief nurse of Ramsay Australia without having a PhD? Potentially, absolutely. But prior to coming to Ramsay, I was the director of patient safety for New South Wales Health. So I ran the safety program, and up to me commencing, the first qualification was you had to have a medical degree. You had to be a doctor of medicine. So I rang up and said, I'm actually a doctor of nursing and I have a PhD in patient safety. And the job is a director of patient safety. So I would argue that I potentially have the qualifications to do the job, but I don't have a medical degree. And they said, look, apply. And I was very fortunate to be given the job. It was a job I loved. So I think some of those career things, I always say ambition is not a dirty word. If there's things that you want to go for, that you want to work towards, career-wise, it can open doors. Your expertise to speak at conferences, and it's great because it's something you're passionate about. So I love talking about patient safety. You know, how do we keep patients safe in our hospitals? So I think there's the intrinsic, what you learn about yourself and your own resilience, the skills you pick up on problem solving, writing, critical analysis, and then there is career progression. I didn't want to be an academic. I loved being at the university, and I thought, oh, I would go slightly crazy here. I work in hospitals. I work in intensive care. You know, we like things to move a lot quickly in health, a lot more quickly in healthcare. Sometimes in academia, love the discussions, but wanted to work in hospitals. So I think the reality, it does open doors. Those opportunities that come to you. Your ability to speak at conferences with confidence on a topic that you know, that exposure to get your message. For me, it's getting patient safety stories out there, and I think that works really well. You know, are you going to get some massive promotion just because you've done your PhD? Not necessarily, but it does open doors. That's the reality, because you are recognised as, an absolute expert in that area.
No, thanks.
I might just touch on something Bernie said there. I think she mentioned about getting in academia, and a lot of people, first question they ask me when they know I'm doing a PhD, they say, what do you want to do after? Do you want to become a professor, or do you want to become an academic? And I'm on the same sort of train as Bernie, is that I don't want to be an academic. I do some teaching at the uni at the moment, and I love it. I love teaching the students and helping the future pharmacists learn. But I also think the connection to the clinical side of it and staying clinically relevant and providing that care back to the patients is ultimately where my focus will be. So I guess just people that are considering a PhD, if you go down that route or a formal research qualification, doesn't mean you have to then be an academic. You can stay in the clinical world, you can continue to help patients. And I think that's important to understand, that it doesn't just benefit you from an academic perspective, it also does help your clinical skills and enables you to be a better clinician as well as a researcher.
And is it fair to say that as a clinician researcher, you feel that you're more empowered to make changes in the system and to help the system evolve and patient care to evolve because of your PhD and your background in research?
And look, I think mine's more not as, whilst it's a, clinical research, mine was around processes. So implementing processes and pathways for recognition and management of deteriorating patients, understanding the communication and territorial challenges around clinical care and communication, and what would prevent somebody from intervening for a patient at risk. What are the barriers to providing safe environments for patients? And there are quite a few of them. So whilst I didn't do clinical research on a particular medication, treatment option, management of patients per se, mine was much more around the systems of care that we deliver in hospitals. And for me, yes, it's that's been a huge benefit, because yes, I know how to look at a deteriorating patient system, but I also know handover, communication, all of those process. So I think for me, I didn't stay clinically practicing. Clearly, I'm still a nurse as the chief nurse. I'm much more in a management administration sort of role, and I think it makes me a much better administrator because I understand those processes in detail, and I've studied why change is challenging and what are the barriers to those sorts of things. So even from a hospital management, or if you're an allied health manager or a pharmacy manager or chief nurse, those having that doctorate, you can still work at that process level, and I think it makes you, for me, I think it's made me a better manager because of that.
Liam and Karl, there's been a question in Q&A just asking about how much time on average you would spend on your PhD. So given you're both in the midst of it at the moment, how much time do you think it would be? How do you manage that work-life balance?
It varies a lot. I'm sure it probably varies too, depending on not only the time you are during your PhD, and when you have things that are due or, due dates to meet, I'm sure you're going to be working a little bit harder at those points in time. But on average, I tend to spend that day that I mentioned earlier, that sort of 1 day a week, is dedicated time that I put aside, that I work on a full time on my PhD. So I would say that's sort of just like an 8-hour day or thereabouts, give or take, depending on what's going on. And that probably does me for most of the time, but then there are other periods when I'll be putting in a little bit of extra time here and there, depending on when things are due. So if I'm submitting a paper or having to get ethics done or just having to meet some other milestone or get something else ticked off, then occasionally there'll be other time put aside to get some things done. But in answer to your second question, I think probably one of the most important things is just to understand how it fits within your week and where the time and the energy is coming from. And so that's probably in the last year or two, something that I've learnt. The most important learning that I've had is just knowing if I'm taking something on, where is it coming from? And just knowing, for me personally, I have family time, work time, and PhD time, and then self-care. And then just knowing from those buckets, I guess, where am I spending my hours or where am I spending my energy? And so that's probably the most important thing, because nothing's going to be sustainable if you're forever taking hours out of family or self-care time. It just won't work. But I guess probably just the most obvious answer is probably 8 to 10 hours a week at the most, with the occasional few extra here and there, I would say, for me.
Yeah. Liam, does that resonate for your experience?
Definitely. I think the big thing that resonates there is the ups and downs that Karl mentioned, depending on what you got. For example, at the moment our team is submitting a paper, so we've submitted it. We've got the reviewers' feedback, and they often only give you a short amount of time before updating and sending the next draft in. So lately we've been spending, I've been spending a lot more time on it. But for example, when I first started, I was spending a lot of time putting together study protocols, ethics, drafting the legal agreements, all those different things that go around research. And then we had COVID hit and things sort of slowed down a lot. So obviously that COVID is not a common occurrence, but you do get those periods where you're waiting on certain things to come back and you might not be able to take the next step. But then it does ramp up a lot. So, over probably similar to Karl, if on average, maybe 1 day a week, sometimes I find that work might be really busy, and that's where that flexibility is really important. And I think I'm really lucky. I've been with Ramsay since I was a pharmacy student. I've been nearly 7.5 years now with Ramsay, and they've been particularly flexible around research time, and also vice versa, where my supervisory team are flexible. If work gets busy, that we might need to move the research time a bit to adjust for that. But I think both parties see the benefit of working and studying in providing that expertise from a clinical setting, whether that's teaching or bringing that back into the PhD, that the academics might not have that recency of what's happening in the clinics, and vice versa, of the research skills that we've already discussed, bring that into the workplace. So that flexibility is really beneficial, and if you can find some way that your research fits in with your work and that your employer is flexible alongside your research team, that's when you really get a good combination of work-study balance. And then, of course, Karl mentioned you've got to fit that life balance in there as well to look after yourself and maintain a healthy balance.
And I guess Liam and Karl, you both sound like you've got fairly flexible arrangements with both of your employers, and your managers understand the time commitments and things required for the PhD. What would be your advice to anybody who's thinking about it? How should they go and engage with their manager to have a conversation? Because some managers, if it's a fairly strict 9-to-5 job, it might be hard to fit it in there. How do you start that conversation with your manager?
It's a great question. It's probably
threw that one in.
Yeah, absolutely. It's probably so individual. For me, I would just either just contact them in any way, really, just probably walk up to them and say, hi. And I mean, we have a very open conversational, workplace relationship anyway, where we share a lot of different thoughts and ideas. and throw a lot of different things around and just see what works and what doesn't, and we're sort of not afraid to try things. So it really is not a big deal, or it wasn't a big deal to me to just say, hey, look, this is what I'm thinking of doing, what do you think? And more often than not, it will be met with, it will always be met with a positive response. It won't always be 100% yes, let's do it, start whenever you like, but sometimes it'll be like, I love it, it's a great idea, have you thought about this? Or let's sort of catch up next week and talk it through in more detail. Or so there'll always be an openness to and sort of an acceptingness of the ideas that sort of we come to management with, which I think we're incredibly fortunate to have. So I would encourage people just to simply bring it up if you feel comfortable doing so. If not, if you don't feel confident doing that, or if you're a bit unsure, I wonder whether there might be someone. Certainly, you've got a few people here that you can connect with. You're most welcome to reach out to me and have a chat. But if you know someone that you can connect with that has done something like that, maybe created some change or gotten involved in something different, get yourself a mentor or speak to someone you trust or can pass around ideas with. I think that can certainly help as well, and start the ball rolling there, or get the conversation started.
Great advice, Karl. Liam, anything to add?
I think, yeah, to building on what Karl said, it's a hard one to answer, because I think I was being very fortunate that, even since starting the pharmacy manager at the hospital I started at was very supportive. But I sort of evolved in discussing it with her, and she's actually now on our research team. So she's now one of the clinical supervisors on my PhD. So she was involved back when I was doing a Master in Medical Research. We brought her in as a clinical supervisor, and also engaged her to get her clinical knowledge because she'd been working in pharmacy for 20, 30 years. So sharing that research opportunity with her as well as the manager, and that really brought, I think, her into and sort of benefit of it, and then how we could adapt in the workplace to make it beneficial for everyone. But I think it's like Karl said, I would say, talk to your manager, and talk to your manager early, so it gives them time to say, I'm thinking of starting a PhD. I'd probably start in 6 months' time. I'd love to stay here. How do we make this work? And I think a manager will be much more appreciative of that than you turning around and telling them, I need to go part-time next week because I'm starting my PhD. So just start that conversation early and discuss, and have it as a two-way conversation rather than that one-way conversation, and you will probably benefit from it too, in gaining some lessons you might be able to adapt into your research plan.
I think that's great advice. Planning, engage early, be flexible, and see where the conversation takes you. I think that's certainly how I'd approach it. Bernie, can you remember you were in a slightly different environment because it was very much a research environment already? Does that resonate though?
Yeah, definitely. And I think too, it's what you can incorporate into your work. So my clinical research was, and I was a nurse unit manager at the time, in charge of the ward. So, I was able to do that clinical research as part of my work. And then I had gone on to be the head of patient safety for the hospital. So part of my job was to resolve this situation. So it's sort of, I wasn't researching something outside of my field, or, in a different facility. On the ground, the conduct of the research was with participants that I had to work with anyway. So that I was very fortunate to get, to have that environment. And then it's really about the flexibility. Towards the end, I did take a few months off to write up the analysis, because I was finding I'd get to a point, late one night, and then, I'd come on the next day or the day after and go, where was I going with this? And then I'd go, oh, now I know where I was. And then, I'd stop, and then I'd come back 4 days later and go, what was I thinking here? So, yes, I definitely had Microsoft Word when I did it. We had computer, but like some of the functionality now, like dictate and all of that, putting all my thoughts down, I still type with 3 fingers. So I think that, the advantage to contemporaneously record your thoughts and where you're going and progress is really good. But yeah, I sort of, towards the end, I had long service leave, and I said, I'm taking 4 months, I have to write this thing up. So yeah, allowing that flexibility is important.
Perfect. And I know one of the things I've been told about when you're starting your PhD is that your choice of supervisor is really, really important. Is that a statement that you guys agree with? And how did you go about finding your supervisor? Liam, start with you.
I think I 100% agree with that. It's really important that you have your supervisors around you that you can work well with. I think the difference between sort of undergraduate and even some postgraduate studies, when you get into a PhD, it's almost switching that relationship from teacher-student to collaborators. So I think it's important, whilst you still are learning a lot, obviously, from your supervisors because they've well experienced in the research, your topic is a collaboration between you and your supervisors, and it's usually something new in the space that hasn't been done before. So together as a group, you're working together to build that idea of that project. So having supervisors there that are able to assist you and you're able to talk on that sort of collaborator level, I think is very important. And I think for how I found my supervisor is kind of an easier one, I suppose. You know, it's a question I always find hard, and people come and ask me, how do I find a project? How do I find a supervisor? I was sort of lucky that just through my undergraduate study, my master's, that I sort of connected with one of the academics at school, the pharmacy school, and we discussed getting into research and then just taking on these projects, and it sort of snowballed into a PhD from there. So I guess my advice would be, if through your undergraduate study or other postgraduate study, you talk to an academic and they have an area of research that interests you, connect with them, get to know them, ask them to be involved. If you can go and just spend some time around what research they do and finding out and building that connection, and then potentially a PhD project might come from that.
Yeah, 100% agree with that. Mine was a little bit different. Like I was saying earlier, I wanted to do research, but I didn't know how. And so I connected with an old lecturer from uni who I knew kind of, or I hadn't spoken to for a little while, but I just reached out and told him what I was thinking. And fortunately, he sort of said, yep, come in, let's have a chat and see what you'd like to do and maybe what I think might work. And so I was able to connect with people after uni. So I would definitely consider that. Certainly the people that you know through unis or otherwise that might be able to be helpful would be a really good way to start. And I actually I had no supervisors. I had no one lined up. I didn't know even how to get that going. So I did a lot. It didn't work in the end, mind you, but I did a lot of cold calling. Like I just contacted people who were prevalent in the field, conducting a lot of research in areas I thought I might be interested in. I met up with a couple of people. I exchanged a few phone conversations and emails. None of it really worked out, which is probably for the best at the moment now, because just that linking with the university, I kept in touch with this particular person who then was able to say, oh, look, actually, this person's just has a PhD candidate who's submitting soon and finishing up, and they'll be able to take you on. Would you like to speak to them and see if it's a good match? And so in that way, I found my primary supervisor. And then I wanted a secondary supervisor because my primary wasn't in the field of neurology. There was a bit of overlap there, but it would have been nice to have someone who was a bit more specific. And that one I found through a work colleague here who had worked with someone else and said, what about this person? I think should be perfect. I can tee up a meeting. And again, it was through people I knew, which is always a lovely way to meet people because you get a little bit of backstory and you get to know what they're like beforehand and to make sure it's going to be a good fit. So yeah, when we say to people, oh gosh, it's so good to have a fantastic supervisor, it's such an important thing. It's a hard thing to do. You know, how do you do that? That's tricky. And I think a lot of it comes down to luck. But hopefully if you can pull in a few resources, contact some people, see who you meet along the way, see if some projects become available, see if you can meet some people that you click with, or like Liam said, who you respect from past knowings. It's a good way to get started.
So Bernie, we know you had an academic professor in your unit and that kind of helped you, and that person ended up being your supervisor. Any other tips that Karl and Liam haven't mentioned around how to track somebody down, so to speak?
Yeah, look, I think in the, definitely, as Liam said, like the faculty that you've worked in, that you've done your undergraduate degree, it's always reach out. They, love having students, so having doctoral students at that level. So, talking to them, they might, as Karl said, oh, that person's just done some research, or they're just finishing a student in that area, might be of interest. But, just go to the, dean, the head of nursing, or the head of, the head of the college, or whatever it is, and ask them what you're interested in, what those meetings are. I had a change of supervisor halfway through. She became unwell. And I remember at the time being terrified that, that you were going to have to, that because she believed in me and trusted in me, and I had that, relationship, and it was quite frightening, thinking, oh my God, now what am I going to do? And, I was very fortunate with my second supervisor then to take over, and, gave me a different perspective again, which was really good. So I think that you want clearly somebody that is interested in your work, that has that, collegiate generosity, as Liam said, that collaboration, but you want somebody who's going to challenge you as well, and push you further and push you harder, and say, yeah, that's fine, but you haven't talked about why, or you need to do another level of analysis around that. That they're not afraid to really push and challenge you. And I think finding somebody like that is great. And, of course, my, second supervisor were lifelong friends. It's you have that relationship, and, now we constantly have who owes who a favour, or, could you look at this student for me, or, she'll come and speak at one of our conferences. I still lecture like Liam at university for her, so I go and do patient safety talks. So, and it's okay not to, to start and think, I actually don't think this is necessarily going to work. If you think that, you have to call it early, because I've had people that have gone 2 or 3 years down the track, and they're like, oh my God, my supervisor's a nightmare, and I'm like, and they're just not progressing, they're not working, they're not, they're not focused. It's all about this, interplay with what the supervisor wants the doctorate to be, because they've got a passionate and then an interest in it, and so they're trying to drag your research into the direction that they think it should go, when it's not where you understood it to be. And whilst having a challenging is really important, it's okay. I've had people that hasn't worked out, and then you can get a different supervisor, and it has changed the progress of that. But if you look at people who drop out of PhDs, and the attrition rate's relatively high, the relationship with the supervisor is often the number one reason as to why. So certainly it's time and commitment and those sorts of things, but that, if you've got somebody who absolutely trusts you, believes in you, has your back, and will push you, it's so important, especially at the end when you're like, no, I'm done. Like, even after 5.5 years, I'm like, I don't think I can keep going. They're like, yep, you're nearly there. So it is. You've got to push to the end.
And am I right in saying that the choice of university and where you do your PhD is really linked to your supervisor choice? Is that a fair statement?
It can depend. It can also depend, different faculties, depending on how big they are. They may have, a couple of professorial appointments that are all honed in on X, Y, and Z. And so therefore, there can be, certain universities are known for certain things. Oh, if it's about this sort of research, they're really forging ahead with that, or this faculty is really focused on it. So, I think it is clearly dependent where your supervisor is working, but some of them will have a definite direction that they're going in. Read their research statements, read their 5-year plan, read, is this what, they might say, we're invested in clinical research in X, and you think, well, I'm not really, but this university does. So definitely read their research, their 5-year plans, their statements, those sorts of things, because it can give you a little bit of an understanding. Talk to somebody who's done a PhD through there, go to their alumni webpage and find people on LinkedIn. LinkedIn's pretty easy to connect. Say, oh, I noticed you're an alumni of University of Melbourne. did you do PhD? What was it like? You know, there's a lot of those sort of groups you can put your feelers out as well.
So LinkedIn stalking's okay.
Yeah, totally fine.
So we've had another question in the chat around how hard was it to apply for a PhD, and did you have to do your master's first? Any takers on that one?
Yeah, once you get set up, it's been my experience at least, once you have your supervisors, you start then, at least in my experience, we didn't have a topic, so then you start working through the topic. They sort of facilitate you going out there and exploring and working out what that might be. But once you start getting all of that sorted and you start working through the application process, you then have the support of someone or more than one person in your supervisor there, and you're not expected to sort of know how all of that works, although it is expected that you get stuck into it and have a go, but they're there to help point you in the right direction. So it's a bit of a process, you know, a lot of that admin side of things and applications and all the bits and pieces you have to work through. Sometimes it can, you know, there's a bit involved sometimes, but I wouldn't say it was too nasty because I was well guided and supported throughout things like that. So I didn't think it was a big deal.
Liam or Bernie?
Yeah, no, look, I agree. I think, you know, depending on what it is, that most places would like to see your academic credentials. So already having a master's pushes you, you know, high on the list if they're wanting to invest in you. Look, the funding changes, they're Commonwealth supported placements, so you don't pay to do a PhD. You don't end up with a HECS debt, so they're free. The government are paying for these. You know, I think you know, apart from the grey hair and the stress, you know, the only thing I paid for, I think I paid $180 in 7 years student fees. So I could, I don't know, go to the Christmas party or something at uni, at the social club. That was about it. So they are free degrees. So because of that, there are milestones that you need to meet along the way around your topic. You know, when you've submitted your ethics applications, all of that. They used to work in years gone by where you would sign up and then, you know, the government would give the university the money for a Commonwealth supported placement, and you could, you know, these people, they said, oh, I spent 15 or 20 years meandering through life doing my PhD. That's not happening anymore. The universities get payment for milestones, so they want you to reach a milestone point and then they get the money from the Commonwealth to stop giving the universities money and then there's no accountability around when people complete. So they, you know, very invested in having the placements, having the positions, but really making sure, do you have academic credentials? Are you, you know, are you supported? You know, what's the topic? What's the supervisor thinking? How likely are you going to get ethics approval for this? So there's a lot of things that they consider in the background to commit to support your placement. But, you know, like Karl, I'd say a lot of it's administrative. You know, there's you know, a lot of positions, not all of them get filled, and then there's a high attrition rate with PhDs. So they are, they want you to succeed. So there are people there to help you apply. But having had, you know, sitting on a master's already, having academic credentials, having a supportive workplace, having years of experience, all of that clearly is, yeah, in your favour.
Mm. And speaking of masters too, I'd like to hear what Liam, his process as well. But for those of you who don't, I didn't. I was just a couple of years out of uni and didn't have a master's and hadn't had anything published. But you do need that, like Bernie was saying, to be considered. So La Trobe doesn't do it anymore. I don't know if other universities do, but I started a master's. I did about 2 years worth. And then there was a pathway where you could upgrade. So I started my master's, I showed some work, some writing, I had applied for ethics, I had submitted something for publication. I was sort of showing that I could you know, produce work at the standard that was required, and then I could submit an application to be upgraded. So that's the process I went through for anyone who's interested in that, and there may still be unis who offer that pathway.
Thanks, Karl. Anything to add, Liam?
Yeah, just to touch on that quickly, just adding extras that, so with me, I did my Master of Pharmacy, which usually if you've done a Master's, you then be able to get entry into a PhD. But at the time, our masters didn't have enough research points associated with it, so it didn't qualify for that research masters. So then I had to go and do my Master in Medical Research first before going into my PhD. So as part of that, that gave me obviously that research background. There are other pathways for people that have been, say, clinicians for a long time that may have published papers in that area, not needing that research degree, but still that shows that research experience. But if you are wanting to get into research, just because you haven't got any experience doesn't mean you can't do it. Like sort of Karl said, he started at a master's and then transferred across, or you can start a master's degree or an honours year, and then with that, then transition across into the PhD. So it's all, I guess, a process of developing those research skills to then get across into the PhD as the top level research degree.
And I guess a key takeaway there is if you are going to embark on a master's with an intention to do your PhD, make sure the master's structured so it does let you flow into that.
Absolutely.
Yeah. So guys, when you think back to your choice to starting your PhD or as you've gone through it, tell us in one sentence or less, what was the best advice that you were given when you were thinking about it? All right, you can have more than one sentence.
Mine is something I'll always remember. Someone said, it's not especially exciting, but they just likened a PhD to an apprenticeship where you learn skills and develop work along the way. But like Bernie said, it's not the end game. It's just an experience where you get to learn and grow as a clinician or as a researcher or just as a person, and come out the other side with having contributed to the evidence base that we all work from, and developed research in a field that hopefully that you're passionate about and made a bit of a difference. And then on the other side, have some skills that then hopefully you can take and apply afterwards. So yeah, it made me realize that, I don't know, maybe I just put a little bit less pressure on myself there to get everything right or be amazing at everything, because it's an apprenticeship. It's a process that we're going through, we're learning. So yeah, I thought that was cool.
Thanks, Karl. Bernie or Liam?
Yeah, I think I remember because I had finished my master's first and then went straight the next year, went into the PhD, and it was the sense of, the master's is like this very difficult pathway that's been built that you've got to follow, and then you get to the end of the path and so you've got to pick a destination and you're building the path because it's your research, it's new, it's you're laying down the evidence for the next people to follow behind you. And I remember thinking it was, this incredible responsibility, as Karl said, you're adding to the evidence base that we as clinicians all work from. And so that sort of, kept it exciting that, I kept thinking, I'm building a path, but that was the, and the other thing too, I know, as I said, I'll talk about passion, but I, towards the end and I was doing the analysis and you just think, even after all this time, just got to keep going. You've really got to want it in the end. You've got to be really hungry. You've really got to want it. You've got to see the end and just head down and get there. So I'm not saying that in a negative sense, like it's, doom and gloom. It's hard work. It is really hard work. But I was very conscious of that. I'm building the path for the next researcher, and then they'll get to the end of they'll get to my destination, and then they'll build the next path. So, I took that responsibility very, it kept me going for quite a while. But it's, you got to want it in the end.
Liam, best advice you were given?
Yeah, I think for me it's probably a little bit of a downer, but to keep in mind that there are tough times as you go through. You've got to be realistic as well. As Bernie said, it is hard work. At times when you get that paper published, it's exciting and amazing, but getting to that stage sometimes can be really tough, and there are those ups and downs. And just keeping in mind, I guess echoing Bernie's sentiment there, the end game of where you're aiming to get to and what the goal is, because there will be times that are tough, and no PhD, I guess, ever goes perfectly to plan when you start. But that's the whole point of a PhD. That's the whole point of learning, research, and developing a plan, developing protocol, and learning those skills to adapt along the way. So, I guess the advice I got was in those tough times, always just remember the end game and remember where you're going and what you're trying to achieve.
Yeah, excellent advice. So we've covered off on some of the survival tips: flexibility, good work-life balance, choice of supervisor. Any other survival tips for anybody considering a PhD or even doing one right now?
I think a plan. I think having I think part of it is understanding yourself and how you work as well. I'm a leave things to the last minute and push hard and get it done, but that's not how you can do a PhD. So what are the vital chunks? What you need to do, and then develop early your system. The one thing I would say up front is get your ethics in early. Make sure you know what you're doing in terms of your subjects and all of that. I had a slight change at one point, and I thought, you know what, I'm going to have to get a second ethics application now, and that was very frustrating because it put a block. So being really clear, get your ethics early, and then structure to how you work, what's going to work for you, around that. And I joke that I have I was doing a thematic analysis of all the interviews and things with staff, and I had all coloured highlighter pens, and I still remember getting home one day and the kids were doing drawings, and I was like, oh my God, who's got my cognitive dissonance orange pen? Where's my orange pen? So you kind of, and I thought, wow, I've really taken this structure too far. So I think it is understanding how you work and getting that in place early. Like, is it, Karl, if it's a day a week, then that's it. It's quarantine. That's how you do it. Get a work plan together early.
Liam, did you have a survival tip there as well?
Yeah, I was just going to say, for people who are looking at doing it part-time alongside their work, if you can, try and tie it into your employment and into your day-to-day work. If you can tie it into what you do at work, it makes things a lot easier because you're both building your skills at work and also as a researcher. So I think that would be a big tip of mine. Yep.
Karl, any thoughts?
I don't know. I think just being able to practice good reflection and self-care is going to be incredibly important. Probably goes without saying. And I like what Bernie says about having a plan and having chunks along the way. I think when some people think, oh, I'd have to do it part-time, and then they talk to someone and I say, yeah, it's going to be a good 6 years. And that just scares a lot of people off, and probably rightly so. But to be honest, you have goals along the way that you achieve, and that's exciting. Like, as Liam said, and Bernie, every so often you're going to be publishing a paper, and that's exciting. That's huge. And then, you might present that paper at work or at a conference, or and then, slowly then you move on to the next one, and it breaks this big, outrageous thing into small, really exciting milestones. So I don't know, when you think about the length of time that it's going to take, I would, consider it. Talk to people who have done it, talk about the things, the goals that you achieve along the way. And it's not as scary as it sounds.
And that's a perfect way to end, Karl. We're right on 4 o'clock, but I'll just note for the audience that if anyone has any questions, I'm sure Karl, Liam, Bernie, I know myself, would all be willing to talk to you and to discuss or talk through what you're thinking about. So feel free to reach out. Thank you very much to my panelists. Great session. And congratulations to Liam and Karl for choosing to do a PhD and for going so well about doing it. And Bernie, I can't believe that you went and did more study. So, clearly you can do it.
Why have 4 degrees when you can get 5? So
the extra ones. The extra one's always important.
Yeah.
Thank you all. Have a lovely day.
Bye.
See you later. Bye.